Hi, everybody. This is Dr. Francheska Perepletchikova. Today, we have a privilege of welcoming clinical psychologist Marit Colvin, who is from the Nick Weill Institute from Oslo, Norway. She is a head of an outpatient child mental health clinic at the Institute. Marit, welcome. Thank you so much for taking the time to be here and to share what you have learned and your experiences with children with severe emotional and behavioral dysregulation. So, what I wanted to know is, well, Marit have done many different studies, which is extremely wonderful and important. And thank you so much for doing this very, very important job. And as a also researcher, I know how hard it is. And oh, by the way, I just wanted to note that Marit and her group in Norway were the very first clinicians that I have trained in DBT for children. It was, what was it, 2017?
Yeah.
Something like that? Yeah, many years ago. And since then, Marit took the intervention and started to look at the application of the technique to children in Norway. And she's, of course, going above and beyond in researching and doing a lot of investigation into the disruptive mood dysregulation disorder itself. And today, specifically, we would like to talk about one of her studies in which she was looking at the level of parental stress for those parents who have the privilege and the challenge of raising super sensors. So, Marit, tell me, what is it? Why are you interested in that topic?
First of all, thank you and hi to everyone. And so nice to be here to talk about our mutual interest, Francesca. No, I've been working with these kids for almost 20 years, and especially the parents of these kids. And I found that in 2013, when the conceptualization, in a way, of DMDD or disruptive mood dysregulation disorder came about, it like I found that the way that they conceptualize the children and understand them gives so much help to when we try to find out how to help them.
Mm-hmm.
But there was so little research about these kids because it's such a new diagnosis and still is. And there's still very much to understand about the mechanisms in the children and why it becomes this way in a way.
Mm-hmm. Mm-hmm.
So,
How emotional sensitivity transitions into the emotional dysregulation, because
yeah.
not all emotionally sensitive children develop emotional dysregulation. And the model that we used to understand that has been already empirically supported is this biopsychosocial model in which we were able to really demonstrate, and it's very useful for us to know what that is, what is the mechanism behind it, so we can tap into that, right? So the mechanism behind the development of emotional dysregulation is when you take an emotionally sensitive child and you couple it with the environment that is not necessarily capable of addressing the many needs of emotional sensitivity that we're going to talk about today. And emotional sensitivity presents above and beyond of the needs of an average emotionality child, and not all environments necessarily are prepared to raise the child. Kids don't come with instructions. And we were talking a lot in DBT-C model that good enough parenting is just not good enough. We
Yeah.
have super sensors here, right? Children who are reacting to stress in a very different way. And super sensors need super parents. Who is raised by super parents? Really, seriously, are we born being super parents? No, we need to learn how to do it, right? And when they're not there yet, when the environment does not know what to do with that child, the environment impacts on the child, dysregulate the child even more because they don't understand the needs and they don't know how to address it. And then the more dysregulated child impacts back on the environment, dysregulating the environment even more. And that transaction leads to two products: emotional dysregulation of the child that can be qualified as, for example, disruptive mood dysregulation disorder in the psychiatric diagnosis,
Right.
and The second product is invalidating environment. Does not start that way most of the time. Of course, there may be times when parents may be abusive and neglectful to begin with, but most parents that you can attest to that we work with are beautiful, wonderful, very capable parents who are doing the best that they can with best intentions in mind, right? It just through that transaction, the environment turns into invalidating for one particular reason. They don't know what to do with that. They don't necessarily understand that, right? Yes. So, and your interest is in finding out what that looks like, what the mechanism behind it, and what we can do about it. And one of the things that you have done, you conducted a study on parental stress, right? For
Yes.
parents who have children who are supersensors with emotional dysregulation. So it's already transitioned from emotional sensitivity to emotional dysregulation. And as far as I understand, the diagnosis that you were using for that study was disruptive mood dysregulation disorder, right? And how that parental stress compares to parents of children with other psychiatric disorders, right? And so there were like two groups, as far as I understand.
Yeah. Like with DMDD and other diagnoses. Yeah.
Can you please give me a list of what the other group included? What other diagnoses were included?
Yeah, so we invited everyone that came to our outpatient clinics, different places in Oslo. And if they accepted the invitation to the research, then we did a screening or a structured interview to find the diagnosis that the child had. And in this group, it's many diagnoses, but the main, like the non-DMDD group, it's ADHD,
Mm-hmm,
it's autism spectrum disorders,
mm-hmm,
it's conduct disorders, like
mm-hmm,
with oppositional defiant disorders. It's
mm-hmm, mm-hmm,
anxiety disorders, every one, all the different ones, from panic disorders to social phobias. Yeah.
mm-hmm,
And
mm-hmm.
it's eating disorders, anorexia.
Depression? Was depression there?
Yeah, yeah, depression is
Depressive disorders?
a big part.
Mm-hmm.
So we did like more analysis, like that we compared DMDD to ADHD, especially, and conduct disorder, especially, and anxiety disorder, especially, and depression disorders. So that was
Wow.
the big groups. Yeah.
Okay. Wow.
Yeah.
So the comparison group consisted of children with severe disorders.
Yeah. Yeah. To be in this clinic, you have to have severe
You have
problems.
to have severe
Yeah.
problems, not just
Yeah.
mild psychiatric
No.
issues,
No.
severe problems. Wow.
Yeah.
Okay.
Yeah.
And it was very diverse group of children with severe diagnoses that a lot of the time are comorbid, meaning that they co-occur with disruptive mood dysregulation disorder, right?
Yeah.
ADHD, for example,
Absolutely.
anxiety, depression. So these things occur a lot of the time kind of in tandem. A lot of the
Ab-
time, children with emotional sensitivity are diagnosed with DMDD plus the
yeah.
disorders that you have listed.
Yeah.
So that is a very important study that you've done for many, many reasons. And one of the reasons in my mind is for us to really helps us separate. Is this ADHD, depression, anxiety per se that causing parental stress, elevations of parental stress, or is this indeed DMDD in itself?
Yeah. Yeah.
Okay, great, wonderful. And you had over 200 children that got accepted into the study at the end.
Yeah.
207 as far as info. Okay,
Yeah.
all right.
218 to be precise.
219. Okay, okay, great, great. So tell me, what did you find? What we are interested in talking about today is parental stress. How did you define parental stress?
Like we used or how we define parental stress in itself, it's like general stress that you perceive or that you experience with like the parental demands of having a child. That's like the definition. But what we used was a very well structured interview that's been used for many years
So
in
it's highly validated,
yeah, yeah, yes.
structured interview.
Yeah. Or yeah, it's kind of structure, but it's self-report. So they cross, yeah.
Mm-hmm.
And
Mm-hmm.
it's over 100 questions. And
Quite in depth.
yeah, it's called Parental Stress Index.
Mm-hmm.
And it consists of like two domains, big domains, that sums up to a total stress score.
Mm-hmm. So
And
you
the
have
two,
two subcategories, two
yeah,
sub-scores. Okay.
yeah.
And what are they called?
The one is the child factors,
Mm-hmm.
and the other is parental factors.
Can you
So
give us more on what can you define both for our viewers?
yeah. Okay. So the child factors, it consists of like 7 different subscales that taps into, I have to read here because I don't have it in my mind that easily, but
Of
it's
course.
to which degree the child reinforces the parents if they adapt
Mm.
to the way the parent to the parents.
Be
It's
that adaptive or maladaptive parental strategies. Both of those can be reinforced by the
yeah,
child.
yeah,
Okay.
absolutely. Yeah. So this is like the child's behavior I'm going into now. Yeah. It's the child's mood. Is it consistent? Does it go up and down? Is
Mm-hmm.
it negative? Is it positive? Yeah. It's a hyperactivity and distractibility.
Mm-hmm.
Um, it's demandingness,
Mm-hmm.
also the degree of demandingness and acceptability. So
Mm-hmm.
that's the child question
Acceptability of what?
of the parent and like the world and how the
I
house
see.
is going,
Mm-hmm.
and yeah.
Mm-hmm. Mm-hmm.
Yes, questions about that. And the parental factor is the degree of how the parent feels if she or he is isolated, like alone in the
Mm-hmm.
world of being a
Mm-hmm.
parent.
Mm-hmm.
Attachment, health, your
Mm-hmm.
own health, role restriction, depression, and how the spouse and you are communicating.
Mm-hmm. Mm-hmm. Mm-hmm.
Um, and the feeling of competence. Do I feel competent?
As a
As
parent or as a human
both.
being?
Yeah,
Both.
it's
Uh-huh.
in this scale, it's like both. Do I
Okay.
feel like a competent grown up in a way, but
Got
also as a parent? Yeah, so and besides that, it's 18 questions about like if you lost your job, if
it.
you lost a family member, if you struggle with the economy, stuff like that. And these 3 factors sums up to one total stress load,
Mm-hmm. Mm-hmm.
the toll of being a parent in a way.
Wow,
So,
very, very precise and in-depth measure. Okay, wonderful.
mm,
What did you find? So one more time, we're looking at parental stress in two domains, how the parental stress is being influenced by the child factors versus more with general life factors, plus some personal issues.
yeah,
And then you looked at the level of parental stress between two groups, parents of children with disruptive mood dysregulation disorder versus parents of children with other very severe psychiatric conditions. What did you find?
yes. What we found was that the parents of children with DMDD, emotional dysregulation, like effect size is what we call it, they're they feel much more stressed about or report the child's demands to be much more or higher than the other diagnostic challenged parents or children.
Wow.
So,
So what you're saying is that the outcome of the study demonstrated significant difference, statistically significant differences in the level of parental stress overall or specifically given the child factors. Which one?
the child factors.
So child factors, not the general parental stress. So general parental stress subscale was, the data showed that there was no significant difference in between groups.
No. So what it says is that the parents of DMDD children experience the child's behavior very stressful,
Mm-hmm.
much more so than parents of children with ADHD,
With
conduct
other
disorder,
psychiatric disorders.
depression. Yeah. But we couldn't find like that having trouble with your spouse, having economical difficulties, feeling isolated, explain the stress. You know,
I see.
that was the same.
It
So
was
it
the
was,
same between groups, which is a
yeah,
very important thing to
yeah,
consider because
yeah,
you need to keep the level of stress constant in other areas of the parent's life to really be able to demonstrate that this is the child factors that are indeed influencing the difference.
yes, that's what we found.
Wow. How do you explain that?
Yeah, there's a different or some different factors that we've been trying to discuss. If this maybe is the factors that explains it, and we have also discussed it earlier, Francesca. But I think there's especially two different factors, or maybe more, but that we have discussed and in the paper, and one of them is that the DMDD, or being emotional reactive to this level where the behavioral outburst comes, you know, like in a high
Mhm.
degree.
Screaming, yelling, disruptive behaviors, verbal
Yeah,
aggression, physical aggression,
yeah, self-harm, yeah, or yeah,
self-harm,
yeah,
suicidal ideation, sometimes
yeah,
behaviors, unfortunately. Hmm.
yes. These children have both like strong internal symptoms and external symptoms. And a lot of the other patient groups have like one or the other, I think. So the
Hmm.
total amount of like devastation or symptom load is higher in this group. That's like
Hmm.
one hypothesis. And the other is about how we as parents experience our child. That, and you use this a lot, and I hope you will say more about that. But this, like Jekyll and Hyde, they're so it goes they like the children have, they have no like cognitive disabilities. Often they have social
They're friends.
competencies. Yeah,
Hmm.
they're
They have
independent.
not that many academic issues. A lot of the time they're
No,
bright, they're
yeah,
very talented, they have all kind of hobbies, they have all kind of gifts.
absolutely.
Absolutely. In
And
between outbursts, they are caring,
yeah, yeah,
compassionate.
yeah,
They can be really understanding of other people.
yeah,
They
and they
can
feel
be real joy to be around.
yeah,
They are a lot of the
really,
time quite
absolutely.
fun. Hmm.
Yeah, and they express so much, some of the times, a lot of anger, and they see what they've done and they really regret it, and they feel like I have no control. And we have done lots of studies on like functioning in the children themselves, like directly tested them for mentalization ability, theory of mind, looking at themselves
Hmm.
outside, and they
Hmm.
do it superb. And the cognitive levels is good often, or yeah. So it's this very feeling of that you as a parent have no like, you don't know when the reaction comes. I think
Yes.
the variation of the child is so high, so you be
So vast.
really,
The
yeah,
difference is
yeah,
so pretty much as far as I understood your findings and what you were able to demonstrate is one of the main ways in which we can explain the high level of stress for parents with children with DMDD as opposed to parents with children with other psychiatric disorders, which is also very stressful. Oh my
absolutely,
goodness, to have a child with any psychiatric condition, this is so awful for any parent to endure, for of course for the child to endure, but also for the parent to endure. So of course they have very high level of stress. So when we're comparing stress, we're talking about already high level of stress. We're just saying which way is even higher
yeah,
based on specific way in which these disorders manifest, so to speak, right?
yeah,
So if you can and please let me know if you agree with that, children with the disorders in the other group, ADHD, depression, anxiety, autism spectrum. So the child every day is presenting with the same level of suffering, with the same predictable ways in which they relate to the outside world in which they cope. So there is no ups and downs. They don't miraculously all of a sudden get out of depression, get out of ADHD, get out of autism spectrum issues, right? It's not that, we can expect the variations and the daily fluctuation in the symptoms. So in a way, it can be stated that other psychiatric disorders can be more experienced as inevitable pain.
Yeah.
Inevitable pain. While children with DMDD, what we see is, just as you noted, the Jekyll and Hyde situation, this up and down, this child who is screaming, yelling, tantruming, being verbally abusive and sometimes physically abusive to other people, right? Demonstrating really high levels of maladaptive behaviors. And all of a sudden, 2 minutes later, the tantrum is done and the kid is a pleasure to be around. Kind of like this switch from very maladaptive to not just adaptive, pleasant, high level of functioning, high level of cognitive abilities, high level of being able to relate to other people and be compassionate towards them, right? So this unpredictability and variability, this is, as far as I understood what you found, causes that increase elevated significantly different, right? In terms of how elevated it is, level of stress for parents, because pretty much at any moment, they don't know what to expect. The difference from inevitable pain, when we can expect what's going to happen, we're prepared. We feel, so to speak, safer in that sense, because we know what to expect and we know how to react. As opposed this EKG, like up and down, up and down, up and down, up and down, and you never know when the other shoe is going to fall.
Yeah.
This is quite stressful. And the other thing is, when those children get out of this mode, right, we call it the prehistoric monkey, comes out and trying to claim control and trying to make everybody to do whatever the child wants. And if not, the child is going to try to force their way. When they get out of that mode and they start to act in this highly functional way, for all intent and purposes, parents look at it and say, well, he can do it. Look at that.
Yeah.
He's capable. So maybe he just doesn't have the will, the interest, the motivation. Maybe he's just pushing all of my buttons on purpose. Maybe indeed he doesn't have a problem that is like physiological, psychological. Maybe it's just he is trying to be a pest to me, right?
Yeah, it's easy to go that way as a parent to think that. Yeah.
And with psychological disorders, a lot of the time it's harder for us to accept that the person is not doing it on purpose, that it's not the matter of will. It's easier for us to validate physiological disabilities because we kind of see in front of us the person really cannot move, right? Really have a problem physiologically, and we can be more accepting, validating, and forgiving of that, as opposed to psychological disorders. But this whole happens in the mind. We don't know what is happening in there. Therefore, a lot of the time, the psychological disorders are being perceived as that just an issue of willpower.
Yeah.
Which is
And it must
absolutely
be
not.
so stressful to see, like, as a parent, to see that like all the other parents and maybe the teachers sometimes see this other side, this really thing, and then why is my child not that way with me all the time? It's so stressful, like shameful in a way. A lot of the parents tells us that it feels like I can't do what the grandmother does, or it's something wrong with me as a parent that makes him like this to me. That is
Absolutely.
many parents
This
that feel that.
variability in
Yeah.
functional level based on a setting. A lot of
Yeah.
the time, these children behave really well at school when they need to keep the
Yeah.
faith, when they need to make sure that they don't lose friends, or they just, behaving in a way that is not going to be disruptive, because they do want to be able to continue to, belong to the group, or for any
Yeah.
other reasons. But the thing is that it's not that they are all of a sudden capable fully and functional fully. No, what they're actually doing is they're holding on for dear life,
I know.
holding on this entire day. And then they come home in a safe environment when they know they're not going to be rejected, thrown out, nobody will ever talk to them again, right? And they're going to lose those family members. No. And by the
Yeah.
way, kudos to you, parents. This is a dialectical thinking moment right now. Your
Mm.
child having temper tantrums at home demonstrates that you created the environment in which the child feels safe enough to indeed let it out. So your kid have been holding on at school or at friend's house, whenever they were in a different setting, comes home, feels safe, they need to let it go.
Yeah,
Yes,
because you're
this
so exhausted of holding
fortunate
out.
that
So now I'm
parents
safe
have,
to let it out. Yeah.
yeah, the parents have to endure
Mm.
this. Absolutely. That's very destructive for the family, 100%. However, this is about emotional dysregulation, meaning that just because they can hold on for dear life, right, white knuckle it at school, does not mean that they can continue to do it, because leakages are going to occur. It's emotional dysregulation. They need to learn ways how to regulate,
Yeah.
as opposed to white knuckle. As we all know, as soon as it's like a rubber band, you you know further, sooner or later it's gonna snap. And that's what's happening with these children when they come home after the exhausting day at school, in which we're holding for dear life.
Yeah. It's the same way in Norway with these kids. It's
Well,
very fascinating. Yeah.
exactly.
Freaking.
And just as you said, teachers are looking at the parents and they're saying, well, this child is a model citizen at school,
Yeah.
so there must be something wrong with you and with
Yes.
your parenting, and God
Yeah.
knows what, it's all
Yeah.
on you. No,
It's
no,
not. But
it's
that's what
not
they
that.
get. The parents gets that a lot. That causes stress in itself. I mean, that is also one of the reasons why we speculate why the stress level is higher. I think getting all that feedback from other, it's something with you because it only happens there, or yeah.
Exactly. Versus if you have a child with ADHD
Yeah.
or autism spectrum, people kind of see, well, it is the same kind of a response regardless of the setting. So
Yeah.
that must be more of a child characteristic and trait, or whatever is happening biologically, psychologically, as opposed with parental contribution to it. Right.
Yeah.
Exactly. On all of these factors will be increasing the level of stress. And one of the main reasons why I wanted to talk to you about this study, the wonderful research that you are doing, is specifically to give this message to the parents who are looking at us right now, who are listening to this video. Guys, this is so hard. What you have to endure is above and beyond what a lot of parents with other children with other psychiatric disorders may need to deal with. And what they're dealing with is exceedingly painful. And your pain and your misery is statistically significantly even higher. So no wonder you're stressed. No wonder you're stretched. No wonder you're burned out. There are reasons for it. It's not just all in your head. Now, what to do with that, that's a different story. And again, you are not to blame for what is going on with your child. This is not that's not about the blame. And that's one of the factors that are increasing stress for the parents. Other people are blaming them and they are blaming themselves. Absolutely. I deal with that each and every time I meet a new family. Parents are so hard on themselves. It's all my fault. And this is the paradox, the paradox of the dialectic, right? Parents are not to blame. And At the same time, they are responsible because they are in this, the most important factor, the most important variable in this transaction between the child and the environment. So this is a statement of hope. You are foundational programmers. You are unquestionable authority. Your children fully depend on you. You have all the power that you need to influence your child and program your child in a way that would be conducive to better functioning, for your child to achieve this life worth living, as we call it. We just need to learn how to do it because we're not born knowing how to be super parents. This is something that's learned. Just like if your child, God forbid, has a diagnosis of diabetes, you're not supposed to know how to treat diabetes just because you're a parent. You need to go to a medical provider and learn what to do. The same is here. We need to learn what to do. And luckily, we have the tools to turn you into a super parent. And Marit, you had other studies that you have done on the application of DBT-C and helping parents to do the needed changes. And the studies that I have done have involved parents and children. Now, and we had fantastic, wonderful effects. However, I just want to touch upon a study that you have done where you just did parent training. Kids were not even in therapy.
No.
Can you just briefly touch upon that study to help our clients, our audience understand, hey, even if your child is not engaging in treatment, and a lot of the time that does happen, we can do fantastic work and we can indeed help parents do what they need to do to help their kids. So what did you do very briefly?
Very briefly, we gathered parents of children with DMDD together in DBT-C in skill training groups, like 12 times, with focus on own emotional dysregulation, understanding of the child. How can I be a super parent, basically? And then we measured like the symptoms of the child and the experience of being a parent. Like, how does it feel? Do I feel like that I can be a parent or
I
that
can be an effective parent.
an
Mhm,
effective
mhm.
parent before and after the groups, the skill, the parent
Yes.
group. And what was very interesting in this study was that the parents experienced a significant reduction or elevated feeling of that this doesn't stress them. The child is my child, and I feel like I feel like I'm a competent parent that handles my
Mhm.
child, and it's a lot less stress in being a parent. So it was like, and this was like a significant result. And it's a group setting, and they also told us both orally and wrote down that they felt like they were ready to go out and be a parent with the child that they had, the super sensitive child, and they were like, I'm looking forward to it, or I know I can handle this in a way. It's a small
Wonderful.
study, so but we know this. This is our experience, right, Francheska, from having
Mhm.
when it, yeah, so it was a very promising study, I think, and it's so good when you see this very heavily weighted parents that feel like they're the worst parent in the world and doesn't understand, can go out like, rest, I can do this. It's my child and I'm proud of my child and it's not stressful. I have tools to manage.
And there
Yeah.
was a very interesting result, not surprising to me at all, when you were interviewing parents at the end. What did they say was the most helpful thing that they have learned through this 12 weeks of training? What was the most helpful?
That was validation.
That was validation.
Yeah.
Validation, validation, validation. Absolutely.
Yeah.
Thank you so much, Marit. That was a wonderful interview, and I hope our viewers received a lot of valuable information. Thank you so much for being here and giving this time and effort. And I see how excited you are about your work. And I hope there'll be more researchers like you doing this very, very, very important work, because we need to learn more. We need to understand more to continue to help our very sensitive children and their families. Thank you
Thank
so
you
much.
so much. Yeah.
Thank you so much. Well, if you like what you have heard today, please like and subscribe. If you want to learn more about DBT for children, if you're a parent or if you're a clinician, please look at the description. There's all kind of information about the courses that are available. And I'll see you next time. Bye.
Bye.